Today I'm going to talk to you about something that is very, very interesting, and it affects many, many people, and it definitely is a health problem that should be addressed. So it's a leaky gut. So today we're going to talk about what is leaky gut. Leaky gut is where the intestinal barrier itself is breached. And we can actually see this in blood work through Cyrex Array 2. We call this the intestinal permeability screen. We can actually see some of the barriers in the blood, such as zonulin and occludin. So we can for sure find out, do you have leaky gut? And so if you have symptoms that ring true when you watch this video, get a hold of us and get Array 2 ordered and find out for sure if you have this, so that we can go after treating it and fixing it. So what are some of the symptoms of leaky gut? Well, one of the common ones is a burning feeling in your upper abdomen. Also, indigestion such as constipation and diarrhea, gas, bloating, belching, and low energy. So these are just common ones. If you have an autoimmune disease, there's a very high likelihood that you have leaky gut syndrome. So let's talk about the mechanisms involved here. So the mechanisms are going to be stressors, and usually it's not just stress, because we all have stress, but it's overwhelming stress over long periods of time. So behind me is a list of some of the different kinds of stressors. You can see that some of them are dietary, some of them are related to medications that you may be on, some of them are hormonal, some of them are related to pH imbalances or lack of movement, etc. But there's many different kinds of stressors. And of course, you have to have emotional events that are really stressful as well. This combination of stressors is what gets the whole process started. So when you have overwhelming amounts of stress over long periods of time, you basically turn on two different systems that are hormonal. And one of them is called the sympathetic adrenal medullary axis. This will increase adrenaline and norepinephrine. This is very helpful for the short term, but not for the long term, as it creates many, many health problems. The other one that it turns on is the hypothalamic pituitary gut adrenal axis. And so notice how I said adrenal on both of these. So over time, this can create adrenal fatigue or exhaustion. So the second one that I mentioned, the hypothalamic pituitary gut adrenal axis, increases your corticotropic releasing factor, which then in turn increases your adrenocorticotropic hormone, which increases your cortisol. So when you have this combination going on all at once, this causes decreased sleep. So we start to get insomnia. We have digestive problems, because when your body's in fight-flight dominance, you don't rest and digest as well. And so it puts you in the wrong direction with your health. For women, we see increased testosterone, and so we start seeing things like PCOS. For men, we see decreased testosterone. And so you start seeing boys start developing breasts, and you start seeing qualities that are not normal in development. We also start seeing thyroid issues, and there's 24 different ways that your thyroid can be abnormal. In the future, we'll do some more lectures on that. We also see with women decreased estrogen and decreased progesterone. So any of this combination we can see. Also, we start to see elevated fasting blood sugar, and we start seeing hemoglobin A1C going up. We also start to see weight gain, and we start to see issues with memory loss and decreased ability to concentrate and focus. We start to see increased anxiety, increased fatigue, and increased depression. We start to also see, because if you're not sleeping and you're not resting and digesting, we start to see increased pain and inflammation, and we start to see the immune system go down. So this is definitely something that many of us can relate to. And so from this, the next thing that happens is we also start to get decreased neurotransmitters because if we have blood sugar dysregulation, we cannot make enough acetylcholine, we can't make enough dopamine, we can't make enough serotonin, and so this stuff really, really affects us. And the other thing that we start to see is decreased function of the hepatobiliary system. So that means that the liver starts to become fatty and we start to get gallstones. So if you see this process happening, you should be thinking about leaky gut. We also start to see malabsorption. So a lot of times people eat food that they don't absorb very well. And you know, they used to say we are what we eat, but it's really not true. We are what we absorb and assimilate. Also, we start to see an altered microbiome because if you change the transient time of your digestion, this creates inflammation in the gastrointestinal tract, and we start to see that you don't have normal gut flora. So you start to see yeast overgrowth. You start to see not enough of the healthy lactobacillus, etc., those healthy probiotics that people need in their gut. From here, we start to see an altered polyvagal system. So we're talking about the vagus nerve. The vagus nerve goes to the heart. It goes to the lungs. It goes to most of the gastrointestinal tract. It affects our spleen. It affects most of our organs to some extent. But we start to see this function go down, which in turn raises our blood pressure and raises our pulse or our heart rate. We also start to see dysphagia, where people have a hard time swallowing things. From this, the next step is that we have decreased saliva production. And if we have decreased saliva production, then that means that we don't make enough amylase, so we don't digest our proteins, or excuse me, our carbohydrates very well. And then we also don't make enough lipase, and that allows us to digest our fats and our salivary immunoglobulin A. So this then causes gastrointestinal inflammation. At the same time, we get a change in esophageal sphincter tone, which leads to gastroesophageal reflux dystrophy and heartburn. We also start to see more belching, more nausea, and more abdominal pain. From here, the next step is we have decreased mucus secretion, which of course is involved in the process of developing an ulcer, and Helicobacter pylori infections. This goes back again to the altered microbiome. And then when we see this, we also see an altered pH due to acid changes, and so we start to get rotting and putrefaction of our food. And so this is what leads to leaky gut. So that causes the whole thing to become swollen, and so then what happens is the intestinal permeability increases, and then some of the food that you actually eat gets into your bloodstream, and it causes an immune response. At the same time, things from your bloodstream can actually get into your gut as well. So it can go both directions. So basically, at this point, we have gut dysbiosis, and this leads to bloating when we eat and distension. So a lot of times if you eat and you feel like, wow, my body hates me right now, I shouldn't have eaten that, that's a sign that you might have leaky gut. And then ultimately we have systemic inflammation where the whole body becomes inflamed. Understand that if there's gastrointestinal inflammation, then there's also going to be brain inflammation. Likewise, if you have brain inflammation, it'll eventually cause gastrointestinal inflammation. So if you have leaky gut, we should be treating the brain simultaneously as we treat the gut, and vice versa. This is what creates the best outcome for our patients. I hope that you like and subscribe and share this with the people that you care about so that they can be healthier. I'll catch you next time.